Hi, I'm Dr. Paul Durai, and I'm a facial plastic surgeon in the Atlanta area. On behalf of the American Academy of Facial Plastic and Reconstructive Surgery, I'd like to discuss rhinoplasty with you. If you'd like more information on the topic or to find a facial plastic surgeon near you, please visit our website at aafprs.org. Typically, the first part of the interaction with the facial plastic surgeon is the consultation. The consultation usually starts with taking photos of your nose and then goes to meeting with members of the facial plastic surgeon's staff. Usually that's a good time to discuss your goals and what you'd like changed about your nose. Most people want to change the shape and size of their nose, and in some cases want to change their ability to breathe. If you can't breathe well, sometimes you want to breathe better. And other times, if the nose doesn't look the way you want it and doesn't fit your face, you want to change that shape. So it's a good time to discuss those goals with the staff member. Afterwards, you have an interaction with the facial plastic surgeon. This should be a very transparent discussion about your goals, and you should discuss freely what you want changed about your nose with your surgeon. Oftentimes, you'll review photos both before and after to convey the information that you want changed. After that process comes surgery. Typically, a rhinoplasty surgery is performed in an operating room or a surgery center. The surgery can take anywhere between 1 to 5 hours depending on the type and complexity of your rhinoplasty. It's very important to take these considerations into account when discussing it with your surgeon so that you understand exactly what the rhinoplasty entails. Some surgeons choose to do an open rhinoplasty and others choose to do a closed rhinoplasty. Oftentimes this depends on the surgeon and the patient's characteristics and anatomy. No one way is better than the other. Really, it depends on the person and the surgeon. It's important, again, to discuss these with your surgeon. Lastly, there are certain aspects to changing the nose shape, size, and function that go into the length and time of the surgery. Depending on how complicated your surgery may be, it may take a little bit longer. In an open rhinoplasty, typically there's an incision right here at what we call the columella of the nose. And in a closed rhinoplasty, usually the incisions are all on the inside or the inside of the nostrils. After the surgery is completed, typically you'll have a cast on the outside of your nose that consists of a hard portion and some tape. Some surgeons tend to put splints on the inside of the nose as well, but again, that's surgeon and patient dependent. Usually the splint and cast come off in about 1 week's time, sometimes 5 to 7 days, and again, it depends on the surgeon and patient. The recovery usually involves some bruising that's found around the eyes and swelling as well around the eyes. Many patients have swelling of the nose as well. Usually at about a week, the tip and dorsum, top part of the nose, are swollen. This swelling can last anywhere from 1 to 5 weeks, but really most swelling can last anywhere from 3 to 6 months, and in some patients even a year. It's important to discuss these with your surgeon so that you understand the exact recovery process and where you may have swelling afterwards. After the recovery process is done and you see your patient throughout the years, it's important to keep a good relationship with your surgeon to discuss your results. The rhinoplasty can also be combined with other facial plastic surgery procedures, and you should also discuss this with your surgeon if you have anything in mind. Again, the rhinoplasty consultation and surgery process can be very rewarding for many patients, and is something that's very important to both us as surgeon and you as a patient. And it's important to find the right person to go through this journey with. If you would like to find more information on the rhinoplasty procedure, as well as a facial plastic surgeon near you, please visit our website at aafprs.org for more information. And always remember to please trust your face to a facial plastic surgeon.